I'm gonna need you to raise your glass. I don't care what you put in it. Here's the nights that you can't take back. We live hard.
Assalamualaikum and very good morning. Okay, my name is Muhammad Azim bin Zawidi. This is my group members, Siti Safida, Shahida Idayu and Grace Sadon. Okay, for my group, we'll be presenting about business intelligence in healthcare. Introduction, I will be presenting about what is business intelligence. Business intelligence is the combination of technology, tools and application as well as method used in the gathering and analysis of data, the integration of system to produce useful information. How business intelligence works? Business intelligence works it took data from the others database and to store into data warehouse. From the data warehouse, it will be process of tapping the data and convert into the useful information.
Intelligent in healthcare. Why use business intelligence in healthcare? So as we know, healthcare generate data by tons. Data are derived from different departments like administration, finance, single employee. Okay, example data that are derived from administration are HR, patient register and staff records. Well, in finance, the data that we retrieve are patient bill and inventory. Okay, move on to employee. The example that data we derive are doctor life information of patient. Okay, why we use BI in healthcare? To know exactly what data needs to be gathered, which data should be used based on situation, and how best to make use of accurate data. Ability to apply business intelligence in handling such as data is vital to decision-making process of an organization. Of business intelligence. In order to gather information from patient, hospital facilities or other service, we use these 5 components, which is OLAP, analytic, management, data warehouse, and data waremark. Let's take a look one by one of these components.
For OLAP, it supports specialized decision-making in hospitals. Analytics analyzes the progress of patient data collected. Management is handles staff working hours and view the availability of every staff. Whereas data warehouse, it reports information of patients, medications, personnel in charge. And for data mart, it exchanges the data across different platforms.
There are many benefits of applying business intelligence in healthcare. One of them, the first one that we look at, is consolidation and protection of data. Now as we know, business intelligence is an integrated system that shares single data among different platforms. It also helps ensure the security of patients' data. For example, in a healthcare organization, there are different levels of authority. Only certain information can be accessed through authorized personnel, providing that they enter the correct credentials into their system to collect patient data. 2 other benefits that BI provides is improved margins and improved patient satisfaction. Now, improved margins is where BI provides balanced scorecard programs to analyze healthcare organization standing and how gross margins can be improved. Whereas improved patient satisfaction is that patients receive timely treatment and have a clear understanding of decisions and procedures made by doctors. Another benefit is improved patient treatment and care. The BI system is a platform accessible to the whole healthcare organization, where patient data can be accessed and shared among different departments. With the availability of such data, it implies that the hospital considers customer involvement. BI also helps reduction of medical errors and improve patient safety. BI systems can support a larger healthcare system by the exchange of medical information of a patient. Decision-making is improved in the area of comprehensive healthcare policy by authorities of the organization of the health sector. Now, our last benefit is better data management, where BI helps organizations manage the data that they collect. With that, doctors can make correct diagnosis on patients at a faster rate. Thus, patients receive effective treatment, avoiding delays. When it comes to implementing business intelligence, there are 2 major issues that we need to consider. The first one is data complexities, where data collected comes from different sources that run on different platforms. Now, the more systems that a company has, the more data is required. Now, with these big amounts of data collected from different platforms, it makes it even more difficult for an organization to integrate such data to where it can produce useful information for reporting purposes, comparing, sharing across different systems. With that, sometimes organizations, because of the huge amount of data collected, they find it difficult to identify exactly which data is important for them to find the correct solution. Now, our second major issue is the lack of available and skilled resources, where sometimes organizations realize that they lack employees or skilled resources that have expertise in the usage of information technology, and that can cause errors which will threaten patients. They can threaten patient safety, loss of productivity, and the failure to realize the quality and efficiency benefits of health information technology. Also, many organizations realize that most of their investment may not be towards information systems. Now, we have come to the conclusion of what BI can do for organizations. Not only does it help organizations improve their efficiency of how data is collected, how it is managed, but it also helps organizations in decision making.
I'm gonna need you to raise your glass. I don't care what you put in it. Here's the nights that you can't take back. We live hard, but we love to laugh. We all thought that we'd get rich fast. Hopped the plane out for greener grass. Found out the green is cash. Don't